presentation today is based on the 6 principles of naturopathic medicine, as you can see. In terms of how this can apply to promoting health and wellness in Tobago, we really have to pay attention to the impact of our environment on our health. I truly enjoyed all the presentations yesterday and today thus far, and much of what has been said I will be tying in terms of why it's important that there are certain aspects of our health and wellness that are not truly being addressed. What exactly is health? What exactly is wellness? These things mean different things to different people. And in terms of finding out how we can address health and wellness in Tobago, it's very important that we try and find out what Tobagonians believe health means, what Tobagonians believe wellness means. Health is indeed a state of complete physical, mental, and social well-being, and it's not merely the absence of disease or infirmity. Bastyr University is one of the premier naturopathic medical schools in the States, and they have actually defined wellness as you can see here. Wellness is inherent in everyone, no matter what diseases are being experienced. And this is very important for us to realize, because many a time if there is a diagnosis, there's a loss of hope, right? If wellness is truly recognized and experienced by an individual, it will be more quickly able to heal a given disease than direct treatment of the disease alone. How are we going to build a culture of health and wellness in Tobago? We must take responsibility for all our choices. Health and wellness doesn't start when you get a diagnosis. It depends on food choices we make every day. It depends on our emotional health. It depends on our interactions at work. It depends on things that we do to our environment that later impact us. So these are a few ideas that I had in terms of how we can approach this. Sometimes when we don't have the information we need in order to make the healthy choices, we tend to do what we have always done. Well, I cook this way, or I shop this way, or I eat this way. So, if we have the information we need, then we can be able to better make certain choices. Simple things as how we are cooking our foods. These are impacting why we are manifesting certain illnesses. What food choices are we making? Are we consuming a lot of processed foods? How are foods being grown? Are pesticides being used? These are all things that we have to have more of a discussion of in terms of helping to make something that is more broad-reaching in order to address true health and wellness in a clean, green, safe, and serene Tobago. I do believe we really have to have more of a discussion with communities. We have different communities in Tobago. Tobago is becoming even more multicultural. We have to find out at that level, what is it that they're looking for in terms of health and wellness? Are there certain needs that are not being met? When we find out what they actually want, then we can find out how we can start creating strategies and policies that would benefit everyone as a whole. There must be more of a liaison between healthcare practitioners and members of the public in terms of trying to come to some sort of midway, some sort of agreement as to what will work in Tobago and what will not. We have to be a bit more physically active as part of truly being healthy and wealthy. because after all, our health is our wealth. Whenever I'm in Toronto, I love to walk. And what enables me to be able to do that is we have sidewalks. I have found that there is, it's a barrier, I think it's a barrier here that we don't have enough sidewalks, so people will not look at that as an option in terms of exercise. Walking for 30 minutes a day, a few times a week, is very effective. We don't always have to get into a car and drive to the gym and then work out and then get back in the car and then go home and sit down in front of TV. That's not health, it's not wellness. When we are getting older and we have knee pain, joint pain, things like that limit our ability to exercise. So if we were to introduce something like Tai Chi, is there anybody who's familiar with Tai Chi in the room? Wonderful. It's nice, it's gentle, it's effective, and it doesn't hurt the joints. So we have to really take into consideration those who would like to but are not able to, and provide the options for them. Yoga on the beach. I was thinking of this concept because one time I opened up a magazine in Toronto, and there was a trip being organized by a Canadian yoga teacher who actually conducted yoga on the beach sessions in Tobago for Canadians in February and November. And it's a relatively new concept, but I do know there are places here in Tobago where you can do yoga. But the thing is, we can extend it so that we don't always feel, well, I have to only go to this place to do it, or I always have to pay to do it. We can organize ways in order to make some of these activities available, because they will make exercise fun, enjoyable. They will involve more of us in terms of taking an active role in our own health. Persons with disabilities. I have worked with a few in the past, and it's so interesting when you actually ask them, what is it that you want in terms of your health and wellness? And many a time they are told nobody ever asked them. It's very important that we help, especially those who are of age, to take an active role in their own health care, as opposed to just doing what they're told. Truly empowering them to live successful, independent, happy, healthy, well lives. I don't remember where I saw it, but there was a beach where they actually outfitted, there was a ramp where people who were wheelchair bound could actually have access to the beach. There are people, I'm sure it's something that we could think of doing here, because many a time we have a disability, whatever it may be, but it doesn't mean that we can't enjoy life the way others do. So in terms of when we are creating policies and strategies and we're approaching these things, it's very important that we have these discussions with all sectors of our population in order to help them meet their health goals. Sexual health. So there's so many concerns that are coming up in terms of why people behave the way they do when it comes to certain practices, but we do have to have a discussion amongst all sectors as to why. There's always a reason why people will behave a certain way. There is no blame, there's no judgment, but if we can truly be compassionate and understanding and truly find out the root cause of some of these behaviors, then we'll be able to address them. And in terms of here in Tobago, there are certain things that go on that we keep quiet about, we are ashamed of, we keep secret. certain behaviors that we enable. And unless these things are addressed, we're not truly going to affect the type of behavior we're looking for, especially in our young people. I have found that sometimes, depending on how patients interact with practitioners, they may not always know everybody they are seeing. So somebody may be seeing a medical doctor, somebody may be also seeing at the same time a chiropractor, a bush doctor, whomever. We have to have more of a conversation as to everybody who is involved in a patient's care, so that we can prevent duplicity in terms of treatment, we can prevent side effects, interactions among different treatments, because at the end of the day, it's not about us, it's always about the patient. It's always about the person who is seeking help. And we will always seek help where we believe we are getting it. And whomever is able to create that space for them to discuss, to truly say, okay, what else are you doing and why did you consider doing that? When we have these conversations, then we are able to have more of a cooperation in order to help each person achieve whatever it is they're looking for in terms of their health. If we are to consider medical tourism in Tobago, we have to take care of ourselves first and foremost. These things we must be doing for ourselves. Each person must be taking responsibility for their own health. But as I said earlier, we can't do that unless we have the information we need. There's a lot that is marketed, and there's a lot of information, and it can be quite confusing sometimes. What do I do? What do I eat? Well, I heard this was good for that, or I heard that was good for the other. Not always, and we're all individual. So we do have individual needs in terms of health and wellness. So if we are to consider medical tourism at some point in time, we have to fix and truly have a collaboration among ourselves, yet then we can extend that to visitors to our island. Complementary medical services, as well as mainstream health services, they're both needed. Patients, people, we all need care. We are always looking for ways to be healthier. We want to manage pain, we want to prevent cancer. We will not always find answers in one place. So we have to be a bit more open-minded, and if we don't have the resources we need here, then we can always collaborate across regions in order to source the information and help we need in order to do so. I have been able to speak to quite a number of people, and growing up I also heard so much about people who repositioned the bouchette, or people who would realign somebody's spine, or somebody who told somebody to drink this tea or boil this concoction. Our knowledge is valuable. And what's happening is, as the people who hold this information get older and die with that information, it's not being passed on. In my botanical medicine course, when I was studying naturopathic medicine, I was learning about so many herbs and plants that we grow right here in Tobago. And these things are marketed abroad for people to keep them healthy, to keep them well. And I always wondered, but we have these things growing here. So in many ways, we can help develop our own traditional medical system. So yes, there are those of us who have degrees and we went to school and learned so much, but it's not for us to discount what the elders here have known for a long time. Yes, they may not have the medical training, but they're wise. And there are certain things that they know that we are only now catching up to in terms of science. So in terms of truly promoting health and wellness in Tobago, I do believe that they should be included in these discussions in terms of health and wellness, because there are patients who will not go to see a medical doctor. They will not go to see somebody who's trained. They feel more comfortable going to someone who understands them, who can treat them at a level that they feel comfortable at. But sometimes those things can cause problems if there are interactions with drugs, if there are interactions with food, if there's something that has been missed. But it's not for us to just discount their knowledge. So it's very important that we get together as a community and truly have these discussions in order for us to make policies and strategies that could benefit us all.